Welcome back. So in previous class we have studied about the role of nurse in, in the care of elder persons. So today now we are going to see role of nurse for caregivers of elderly, role of family, formal as well as informal caregivers. So what is today's topic? Role of nurse for caregivers of elderly. So what are things we should consider for those caregivers who are taking care of the elder person? So caregivers of elderly. So, caregiver is an individual who provide ongoing care and assistance in need of support due to physical, cognitive, or mental health condition. So caregiver can be a nurse or caregiver can be a person who is staying close with the elder person. Maybe his own wife, maybe their relatives, friends, anyone. So caregivers are hidden patients. We can consider that a hidden patients in need of protection from physical as well as emotional harm. Prolonged period of caregiving contribute to stress as well as burnout. So elder persons care is not that easy. So these old age persons will be having mood changes, mood swings, happiness as well as sadness will come fast and it will go fast. Very what they don't have any patience. So in that cases, caregivers are having much stress as well as they will be fatigued. So role of nurse for caregivers of elderly. So as a nurse, what all things we should do or we should teach to the caregivers? So there are mainly 6 points. Caregiver assessment, providing information, linking caregivers to resources, intervention to reduce burden and distress, interventions to improve competence and confidence, potential for harm. So these are the 6 points. So one by one we can see caregiver assessment. So identify key caregiver, assess the caregiver's role and relationships to the patient, identify the need of caregivers, include caregiver in planning, discharge, and providing care to the person at home. So we have to find out who is the caregiver and we have to assess the role as well as relationship with the patient, whether it is going smoothly or what all the roles he should be maintained, that should be taught to the caregiver. Identify the need of caregivers. We have to assess the caregiver to identify the need, whether the caregiver is needed rest or is he is burnout, is he is very tensed or any other issues is having with caregivers. And while planning the care or even the discharge, we have to include the caregiver along with. So that all things included in the caregiver assessment. Coming to the next point, providing information. So teach the caregiver along with the patient. Explain and provide information in a clear and understandable way. Caregiver may need assistance to learn physical and technical requirements of care. Communicate effectively to develop cost-effective plans of care and achieve positive client outcome. So as I told, caregivers can be formal as well as informal caregivers. Formal means there will be nurses, so no need of teaching much. But informal persons, we have to teach what all care should be given. So all those things should be taught to the patient, how to give medications, how to care the patient properly. So we should explain in a very simple as well as clear, understandable way. So most important is communicate effectively to develop cost-effective plans of care and achieve positive client outcomes. So whatever activities the caregiver is doing, it should be in a cost-effective way. And it should create a positive outcome. So that is the second point, providing information. Third point is linking caregivers to resources. So there are so many resources available in the as formal as well as informal resources. So supportive resources in the natural network as well as formal services should be found out. Support groups help by sharing experiences and information, offering understanding and acceptance, and suggesting solutions to common problems and concerns. There are so many support groups out there. So we have to find that we have to link with these caregivers. So all the caregivers who is working in this working in as a network will come together, and they can discuss the common problems which is there in the elders, and we can they can suggest the solution, so it will be better. Formal social support system provides housing, health coverages, finances, as well as respite care. So there is other than this support groups, that is in informal groups, there is formal social support system. So in that they will be covering the housing, health coverages, as well as finance and respite care. Respite care means adult daycare, in-home care, and assisted living services. So basically the respite cares are for caregivers. So immediately the caregivers need some resting period, or they want to take a break from the service. So this respite care can be used. So somebody else will be arranged to take care of that elder person while the caregiver is taking a break. Clear. So that can be taken in home care as well as assisted living services. So that is about the third point, linking caregivers to resources. So fourth point is intervention to reduce burden and distress. So multi-component interventions like support groups as well as proper education in a simple way can be given. Otherwise, comprehensive counseling sessions also can be given to the person, caregiver. So the nurse can do home visits as well as enhance the social supports which is available for the caregiver. So home visit will be very better, so that the nurse can interact with the caregiver and can ask whether further needs or further any help is needed for the caregiver, or if the caregiver is doing anything wrong, so the nurse can correct that in a good way. So that is the fourth point, intervention to reduce burden and distress. So you can add points if you want. Okay. And fifth point is interventions to improve competence and confidence. This will continue in the next video.